Hello, welcome again. So today we're looking at a very special topic, just as the name says, special nutritional needs. So we are going to be looking at all these special nutritional needs that everyone would need at every physiological stage that they are in. Okay, now I think you might not really know what physiological stage you are in, but by the time we're through with this class, you'll be able to know what physiological stage you're in. Okay, let's proceed. Now, before we proceed, there's some things you need to take note of. Now, at the end of this lesson, it is expected that you should be able to define nutritional needs, and also you should be able to state the nutritional requirements for the various age groups. Also, you should be able to describe their different needs according to the physiological stage. Now let's proceed. Now the nutritional needs of humans vary, according to the physiological stage, age, and their health conditions. Now special considerations must be observed when preparing meals for different groups of people based on age and health status or health conditions. Now you need to take cognizance of the people you're preparing food for. Now, if you are in a house where you have different people of different physiological stage, you need to put into consideration that you have infants in the house, you have toddlers, you have babies, and then you have grown adults. Maybe you have your aged parents, your grandma and grandpa around. So you would have to modify the type of food you want to give them because, you're not on the same level as far as to say that. Now, let's see. I want to look at the different nutritional needs of different age groups. Now, the first one we'll be looking at is infants. Now, these people, they're still very small, they're still tender, and they virtually don't know what happens around them. Now, this is the stage when the rate of growth is at the highest. Now, they are growing as to give birth to them, before you blink and they're already growing up. Now, it's also at this stage that they are more susceptible to what? Infections. Now, if you're not very careful, they can be infected because they are vulnerable, because they cannot do or defend themselves. So you have to pay prime attention to what you give them, what they eat, and all of that. So it's very important that you take note of that. Now let's look at the basic nutritional requirements for infants. Now you need to give them high quality protein and in adequate quantity. High quality, now note the word, high quality and high quantity. So if you're going to be giving them high quality protein, you're going to give them in very, very good or adequate quantity as well, so it can be enough for them because that's what they basically need to grow up and be healthy. So the next one is adequate amount of calcium, magnesium, phosphorus for good bone formation. Now these people are growing up and they need all of these things to do what? To stay healthy. Their bones are so feeble at that time and stage in their lives, so you need to equip them with things that will help them grow stronger and become bigger boys and bigger girls as they grow up. And also you need to stock them with vitamin B complex, okay, the B1, B2, B5, B6 complex, whatever, all the Bs, you can give them that, okay, for energy, metabolism, and development of good appetite. At this point you need to make them want to eat and make sure you give them things that can aid them to eat very well. Okay, plenty of water too is needed at this age. You give them water, a lot of fluids. They should take a lot of fluids. Also, it's very important for them at this stage. Let's look at the next people. Now, these are the adolescents. Okay, I'm sure you know the difference between adolescents and adolescents. Okay, now the adolescent is the individual, the person, as per the individual, is that the male or the female, the girl or the boy. Now, why the adolescent stage is that period when they have to experience all that they need to experience. Now, an adolescent is someone who is between ages 11 to 20. You can say that person is an adolescent. Okay, now this is the stage where the growth rate is what? experienced, and it's almost at its spurt. It's at its peak when they are growing, okay? And at this point, they engage in a whole lot of activities. They do a lot of sporting activities for the boys, same for the girls too. And also for the girls, you know, there are a whole lot of demands for them. At that point in time too, they start menstruating, and then, you know, it takes a toll on them as well. And also sexual maturation comes in as well. They begin to see changes in their bodies and a whole lot of that. So their nutritional needs is skyrocket. How do we put it? It's up there, you know, it goes up there. It's on the skyrocket. Like, you need to stock them with a whole lot of good nutrients so they can be able to meet up with the demands of that sport that they are in, and the season where they find themselves at that point in time. Now, what are the basic nutritional requirements for an adolescent? Now, you should give them high quantity and quality of protein to meet that growth spurt. Now, you need to ensure that they take high quality protein. You have to be intentional to see that they take high quality and high quantity quality of protein. And also, at this point in time, they tend to eat big for most of them. You know, their appetite gets bigger, and then they want more food. So you need to ensure that you give them food in large portions. They should be able to eat food in large portions. And also increased intake of iron and folic acid. Now, this is basically for the females because it helps to enhance blood synthesis to enable them cope with the loss of blood due to menstruation. Okay, now, so they need a whole lot of these, and they need a whole lot of fluids, water, because they are, you know, everywhere. So these are some of the things that they need, and you need to give them good balanced meal, balanced diet. They need to make sure their meal is balanced. Not anything goes. You know, everything must be accurate when you give them what to eat. Now let's look at the other people in this stage. Now, these people are very special too. They are the adults and the aged. Okay, now the adults and aged, they're already grown up, right? So they don't need all of these things that we've said about infants and then the adolescents. But notwithstanding, they still need good quality protein, okay, to meet up with the needs of the mineralization that goes on with their bones. So they still need that, but not in large quantity as it is expected of the adolescents and infants. Now, these people need to take balanced diet to do what? Maintain all the loss of their worn out body tissues. Okay, they need to eat healthy as well. They need to take care of themselves too, to be able to meet the demands of old age and all of that, because at this point in time they're going to be losing a whole lot of nutrients, and they need to eat more of energy giving foods, and not so much, but balanced meal. Let's just put to say balanced meal. These are some of the things they need. Okay, now let's look at the nutritional needs according to physiological condition. Now, this would have to do with the different people and what they experience. The first people we're looking at here is pregnant and lactating women. Who is a pregnant woman? I know you know that. Okay, a pregnant woman is someone who is expecting a baby. She has a fetus in her belly, and then in 9 months' time, she's going to have a baby. And also a lactating woman is a woman who is breastfeeding. Okay, lactating mother is a woman who is breastfeeding her baby. After she puts to bed, time she starts nursing the baby, she's giving the baby breast milk. So she's referred to as a lactating mother. Now, a pregnant woman has to sustain herself and the fetus in her womb. Okay, now we're not saying you're going to be eating for two. You know, carry 2 plates and say, oh, this is for me and this is for my baby. No, she's going to still eat healthy. She's going to eat healthy because the baby is going to be feeding from what she eats. Okay, and she has to be intentional to eat healthy foods so she can be able to pass on good nutrients on to the baby, because the baby diet depends on what the mother eats. So she has to be very intentional. She needs to take a lot of iron, calcium to help blood synthesis to help, and also vitamin K to help with the loss of blood during childbirth. Now, a lactating woman too needs the same requirement just as the pregnant woman, because the demand is on her as well. She's going to be breastfeeding, and if she's going to be exclusively breastfeeding the baby for 6 months, so she needs to eat healthy. The same as what is applicable to the pregnant woman. The lactating mother should do the same when it comes to nutritional needs. Now, let's look at these other people. Invalids. Who is an invalid? An invalid is someone that is ill. When the person is sick, you can refer to the person as an invalid because the person is ill. Now, these people, because of the dictate of their ailment and their dull appetite, they require special types of diet to furnish the needed nutrients. When you're sick, do you want to eat everything except you're trying to, you just want to get to mommy and then you're just acting sick? But for people that are really ill, you lose your appetite for food, appetite for anything. You just don't feel like eating anything. So now special consideration should be given to these people that are ill, because they can't really feel anything, they don't want to eat, so you have to be intentional to what you're giving them. Let's look at some nutritional needs according to what they should take, according to what nutrient is required for them to take. Now, when you're preparing food for them, you have to put some of these points into consideration. Now, you need to obey the doctor's directive. Now, if the doctor has said, oh, don't give him this, don't give her this, you need to pay close attention to it, because they know what they would have seen and what the possible consequence of what they have seen means. So you need to follow or obey the doctor's directive. Also, you need to observe food and personal hygiene. This is very, very important. You need to observe food and personal hygiene, because if you're not observing food hygiene, you could get this person more ill, okay? The person is already ill, and then if you don't pay good attention to what they eat, you can contaminate the food and make the person more ill, and that's not good for them. Also, personal hygiene. You have to observe personal hygiene as well, and also allow for variety in the diet. You need to allow for variety. Also, you don't cook around where they are. Most of the people that are ill, when you're cooking around where they are, they just lose appetite. They don't like to eat anymore. So if there's a way you can keep them where they don't get too close to perceiving what you're cooking, fine, is good as well. And also, you serve your food hot. These are some of the things you can do for people that are ill. You can serve their food hot, because cold food will look stale to them. It feels stale. So you can serve their food hot. Try and give them some foods that are not so hard, easily digestible food, as to put. Now, you give them easily digestible food that would be very okay for them as they eat, not to struggle to digest the food. Now, also convalescent. Now, who is a convalescent? A convalescent is someone who is gradually recovering from an illness. Now, this person is not longer sick, is no longer an invalid, and then he was an invalid, but he's recovering, he's getting better, as she is on her way, or he's on her way to feeling better. Now, this person would still feel like they're still ill, but they're on their way to getting better. So now it still means that you need to be very, very intentional with what they take, just as it is with the invalid. The same thing is applicable to the convalescent. You need to see that you obey doctors' rules, others, and all of that. Serve them food hot. You serve them food in small portions. You don't choke them up, and all of that. These are some of the things you need to do for people that are recovering, and then you need to show them a whole lot of love, okay, as people that are recovering from an illness. It's very, very important. That too also helps, and their diet needs to be rich and balanced as well. Now, let's look at these other people. the hypertensive patients. Now, in foods and nutrition, when for those of you that are going to be writing or taking it in your external exams, now there are some questions when it has to do with your practical. They could just come up with any question that has to do with the physiological state. They could say prepare a 3-course meal for a lactating mother, for a pregnant woman, for an hypertensive patient, for a diabetic, and a whole lot of all of this. So if you don't have a background knowledge of all of this, you won't know what is expected of you. Now let's look at what is expected of an hypertensive patient if you're asked to take care of them. Okay, let's say you don't have anyone that's hypertensive around you, but if you have this knowledge, you can be able to do what? Pass it on to someone that might need it. Now, an hypertensive patient is one with an abnormally high blood pressure. That's why you hear the word high BP, HBP, okay? High blood pressure. That means that person is what? Hypertensive. Now, their diet should have its salt content drastically reduced or completely salt-free. Now it depends on the degree of how much the person's hypertensive or high blood pressure has gotten to. Now they don't need too much of salt in their diet. You can actually skip that if the case is severe. You can actually skip adding salt to whatever they eat, because adding salt aggravates the pressure and causes them more discomfort when it is added. So you can do away with it. Doesn't matter. I don't even like too much of salt in my meal, despite the fact I'm not hypertensive. But some persons, it's like they just want to stock too much of salt in the food. It's not good. If you do that, you need to stop it. It has its consequences. Anyways, now let's look at these other people. Diabetic patients. I hear people say they're diabetic, the person is diabetic, and a whole lot of that. Now the funny thing is that when one is hypertensive sometimes, and they go together, diabetic and hypertension, okay? Now you see someone that is diabetic, he's likely to be hypertensive. Now sometimes it's not the case. Some persons might just be hypertensive and they're not diabetic, but in most case scenario, it's always like that. When one is diabetic, you tend to do be hypertensive as well. Now, a diabetic patient is someone whose blood sugar level is abnormally high, and consequently, sugar appears in his or her urine. Now, their blood sugar is high, extremely high. For those persons that are referred to as diabetic. Now, they should do a lot of watching and checking their health. Every day they need to check their health. Just like you see in the picture, there's this syringe pin you use to check your blood every day. The machine is where you can just take that pinch and then you put it on the machine, a little drop of blood, and then it tells you if your blood sugar is okay for the day to go and all of that. All these little checks for those persons that are diabetic. Now they also need to reduce fat and oil. Okay, the consumption of fat and oil, they need to reduce it. And then these people too usually take supplements, which the insulin supplements. They can take insulin supplements, and also they can take more of they can take plantain, wheat, like they said, but you can be able to balance your meal. You should be able to balance your meal. Now let's look at the obese patient. Obese. Now, when someone is obese, that means the person is overweight. I'm sure we see them around most of the time. We just feel like, oh, they're eating well, but no. When someone goes beyond the normal weight, HBV, then that means the person is overweight. Overweight is overweight, and then that person is likely to be obese. Now, the overweight is usually due to the accumulation of excess fat or adipose tissue. Now, this is where fat is stored in the adipose tissue. Now, when this person has accumulated excess fats in that tissue, then the person is obese. Now, such patients should do eat foods of high nutrient values but low in calories. They should take foods with low calories. They shouldn't eat too much of these foods with high calories so they don't cause themselves more pain. It's not an easy experience. I've seen videos of some persons that are, obese, and they don't find it funny. Now, they can't stop eating because they're obese. They get hungry too, but before you get to that stage, you need to start watching it, okay? Eating everything doesn't mean you're healthy, or because you can assess them doesn't mean you should just eat and eat. No, there are consequences to overeating and them not taking note of what you eat, and then it could cause you more health issues. So now I want to look at some special people, the nutritional needs of vegetarians, vegans. We find them around. A whole lot of people are becoming vegetarians now. We have some persons have reasons for becoming vegetarians. Some could be because of their religious background. They just decided that okay, because of our religion, we can take those persons that are still practicing, what the Bible says from way before, and then they're saying no, they don't eat meat, they don't take these, they don't take the flesh of animals and all of that. Some people can decide to become vegetarians because of doctor's advice, okay, because of, like we said, for hypertension and all of that, you're just told to stay off some food, okay, and then so they just become vegetarians, just become vegans and all of that. Some other reasons, traditions, okay, traditions too and cultures can make people to decide to choose to becoming a vegetarian because of what their culture says, food taboos and all of that. We don't eat this, we don't take this, we don't do like this, we don't do that. All of these things can make people to do what? Decide to be vegetarians. Do you know any vegetarian around? Do you have friends, family, or are you a vegetarian? Okay, good and fine. Now let's look at who a vegetarian is. A vegetarian is someone who does not eat the flesh of animals or all the products that are derived from them. But they only take food from what? Plant origin. Only. They just take veggies. They don't eat anything that has to do with poultry, beef, and all of that. The products, egg, cheese, and all of that. They base their diet strictly on what? Plant origin. So you can see them take mushrooms. They can take, they make the mushrooms, soya beans, legumes. They derive their protein from, from plant origins and legumes. So you see them do chunks from legumes, from soya meal, and all of that. This is what they solely, depend on. Okay, it's all good. Now, let's look at the different types of vegetarians. We have different types of vegetarians. Usually we have three, but I think there are more but we're going to be looking at three in the course of this class. Now, the first one we're looking at is strict vegetarians. The strict what? Vegetarians. Now, these people do not eat the flesh of animals, poultry, as well as the products derived from them. They eat only foods of plant origin, okay? They're called vegans. These are the vegans. They're called vegans. They don't eat anything that is related to the flesh of animals, poultry. They don't eat it. They don't take beef. They don't take eggs. They don't take chicks. Their products, they don't take it. They only depend on food from plant origin, and then they derive their protein from legumes. These people need to they have to be very intentional. I think becoming a strict vegetarian demands more. It's more demanding. For me, I feel it's a little bit more costlier because, we have our first class proteins. We can easily get access to fish, meat, beef, poultry, and then we can get our first class protein from that. But for the vegans, they can't really get first class proteins. So they would have to do what? Be intentional so they can be able to get enough of these proteins, which is going to be adequate for them from plant origin, just as we listed. They can take soya milk, they can take what again? Mushroom and veggies. So they can be very, very creative with it to see that they get enough of the required proteins that the body needs, so they don't get, how do I put it? They should be able to complement it properly to be able to get adequate protein that the body requires. Now, the other set of vegetarians, I think I've seen, okay, I know someone that is a lacto-vegetarian. But I've not seen someone that is close to me that is a strict vegetarian. I've seen someone that is a lacto-vegetarian, and the last one that we're going to be talking about. Now, these lacto-vegetarians, these people do not eat the flesh of animals, fish, poultry, or eggs. However, they take milk and milk products, okay, together with what? Foods from plant origin. Now, a lacto-vegetarian will not take flesh from poultry, meats, and all of that. But they can take milk, and they can take products from milk as well. So they can take milk, they can take cheese, they can take butter, you know, all of these products that are from milk, but they would not do what? Take the products. They will not take the flesh of the animal, which is poultry or a cow that produces milk. They will not take, but they take the products of the animal. Okay. All right, let's move on. The last one is the lactovo-vegetarian. Now, these people, just as it is with the lacto-vegetarians, they do not take the flesh of animals, fish, or poultry, but they take milk products and milk, and also add eggs to it, as well as what? Foods from plant origin. So a lactovo-vegetarian can take milk products, such as your cheese, your butter, and all of that. And also they can take egg. So they can add that to that, but they won't eat the flesh of animals and all of these other animals as well. But they would take milk, they can take milk products, and also eggs. I'm sure you've been able to differentiate the different vegetarians that we have. Do you intend to become one? It's fine. It's optional, so you can decide to pick one and all of that. I'm sure you've been able to learn a whole lot that we've talked about today based on the nutritional needs that we have learned so far. See you in our next class. Bye for now.